I want to welcome everybody here today. It's great to see you. It is July 28th, and you are attending the WyTN webinar entitled COVID-19 Disparities and Vaccine Confidence, Ways Telehealth Can Help Support the COVID-19 Vaccine Rollout. Today, we are joined with Holly Scheer. She's the Community Partnership Coordinator at the Wyoming Department of Health, and Holly has given countless presentations on the importance of COVID-19 vaccinations. But this will be the first time that she'll offer that conversation with a focus in how we can use telehealth to help promote the vaccine. Most of you know, my name is Andrea Shipley, and I'm the project coordinator here at the Wyoming Telehealth Network. Also, don't forget to mark your calendars for next month's webinar that's going to be kicking off a three-part series on patient engagement. Next month's webinar will be identifying the best patients for telehealth and then engaging them in inventive ways. We'll be hearing from Karen Richardson, who's the president of the Wyoming Speech, Language, and Hearing Association, as well as her colleague, Chelsea Paulus, who's the owner of Connect Speech Therapy. I've seen a presentation by these folks. They're doing really creative things with telehealth presentations, and you're not going to want to miss it. So I want to thank Holly for being here, and thank you all for being here today and offering your expertise and best practices to improve telehealth in Wyoming. Holly, take it away.
Thank you so much for having me today. So my name is Holly Scheer, and I'm the Community Partnership Coordinator for the Wyoming Department of Health and the Immunization Unit. And I would like to talk to you today about a subject that we're all hearing about pretty much from all sides: vaccine hesitancy and building vaccine confidence, and your role in that as telehealth providers. COVID-19 has been just an incredibly difficult time for all of us, and vaccines help offer us a way forward out of this situation. Understanding the reasons why our friends, our family members, and our clients may be hesitant about choosing to be vaccinated is a vital part of helping them address this hesitancy and helping move them forward into vaccine confidence. Ultimately, helping them move into vaccine confidence can help them choose to be vaccinated. Telehealth visits play a really important role in helping our community make supported vaccine choices, and I'm really excited to have the opportunity to talk to you today about vaccines. Thank you for being with me and having me here with you, and for the work you've been doing during this pandemic. Telehealth might not be the first thing you think about with immunizations, but I think that in Wyoming, this might actually be a really key piece of the picture. For our people here who are still making their own decisions and working through their choices about vaccines, having the ability to discuss vaccines with their care providers during an appointment like a telehealth appointment, when shots aren't an immediate option on the table, takes some of the initial stress off a very emotional decision. Technology is amazing, but we don't currently have a way to vaccinate over the internet. Having patient contact with people in a setting where they know vaccines are not a part of the immediate appointment allows them to ask their questions and have these questions answered without having to immediately then act on their vaccine choice. I really think telehealth can play a completely unique and vital role in helping us build vaccine confidence for people in our state who are still working through when they should get vaccinated. Talking to people and listening to them is one of the most important and best ways we can help support them in their vaccine choices, both during COVID-19 and beyond. I believe talking to people is one of the very best ways we can find common ground and work to build relationships with people and help them overcome difficult situations, including times like our current COVID-19 pandemic. I personally practice this both in my professional life and my personal life. I have talked with people across our state about their experiences with COVID-19 and the COVID-19 vaccines. In the course of these conversations, I've talked with doctors, nurses, teachers, people in the trades, stay-at-home parents, retired people, faith community leaders, and I've listened to the messages and experiences all of these people have shared about the concerns they've experienced with COVID-19 and the COVID-19 vaccines. There's some really common themes across our state, unifying experiences that bring together incredibly different groups with shared concerns and questions about the vaccines. The first common concern that people across our state have experienced is information overload or too much information. This might seem really strange, but one of the things I've consistently heard from our residents is that they're frustrated about the changing nature of information from different sources. I think a really key example of this is the recent CDC messaging about masks. This is particularly true for those in our state who live in border communities where much of their radio and television content comes from other states, where information and recommendation may be different from those from our own Wyoming sources. This can be incredibly frustrating for our residents in these communities. In addition, when national sources provide information that comes out at different times and emphasizes different points, it can feel inconsistent or even conflicting. This can make people feel like they're being misled or that there's a lack of transparency in messaging. And we know here in Wyoming, with our people, transparency is something they value just incredibly. When information is inconsistent or there's too much of it, it's overwhelming for people. This information overload can make sifting through the changing and evolving recommendations very difficult for people who are working and managing their families, and this leads to them sourcing their information instead from family, friends, and social media, instead of from their doctors and public health sources. And we know that so much of this word of mouth information, even when it's well-intentioned, can contain misinformation and disinformation. The very next common concern I've heard from people across our state is about side effects. Not typically just the short-term side effects, although people are very aware of those, and sometimes concern over second dose side effects can be a barrier for second dose uptake for Pfizer and Moderna, especially with people who are concerned about having to miss work if they're sick. Rather, they're concerned about future and long-term side effects. They're worried about the long term and what could happen weeks, months, and years in the future after they're vaccinated. They're worried about a vaccine that's so new and what could happen to both them and their children. One of the most commonly cited long-term side effects people are worried about is about fertility. People are worried about the risk of miscarriage and infertility. They're worried about both themselves and their children. If they're vaccinated, will they be able to have more children? If they vaccinate their child, will their child be able to have more children in the future? We have clear and growing evidence, though, that the COVID-19 vaccines are safe during pregnancy, and we know they do not negatively impact fertility. There was a recent study of over 35,000 pregnant people who were vaccinated against COVID-19, and there were no significant adverse events. Sharing this information with your clients is a great way to address the specific concern and help reassure people. The next major concern I've heard from people in Wyoming is that they feel that the vaccines were developed too quickly. They're concerned about the EUA process and the difference between a fully approved vaccine versus an authorized vaccine. Many of these people express that vaccines typically take years to develop. They typically express the time frame in the terms of 10 years for vaccine development. The people I've talked to express that they are maybe waiting for a vaccine to be fully approved instead of just authorized. mRNA technology isn't incredibly new, though, and the first successful reported use happened back in 1990, which was 31 years ago. And I have kind of weird feelings about 1990 being 31 years ago, but it is quite a while ago. And this is where I think discussing with people that mRNA is something they may be more familiar with, and immunotherapy for cancer treatment might be much more familiar with them. Understanding the factors that drive the hesitancy we're addressing here in Wyoming is only the beginning of this, though. Understanding the problem is the first step of the solution, so we can start addressing the situation as a whole. So it's important for people to understand why the vaccine is actually important and important for them personally. A recent example of this can be found in the results from a nursing home outbreak that happened in March in Kentucky. An unvaccinated healthcare worker who was positive for COVID-19 came to work. 90.4% of the residents of that nursing home had been vaccinated against COVID-19. 52.6% of the staff were also vaccinated. These groups had both doses of Pfizer. The vaccine was very effective at preventing infection in both the vaccinated residents and the vaccinated staff. In the residents, the rates of infection were 25% for the vaccinated group versus 75% for the residents who were not vaccinated. I think that's important to note, especially when we're dealing with an elderly population here. Among the staff, the rates of infection were 7% compared to 30% for the unvaccinated staff. Hospitalization rates were greatly decreased for the vaccinated residents. Only 3% of vaccinated residents needed to be hospitalized, compared to 50% of unvaccinated residents. No staff members were hospitalized. In incredibly encouraging news, death rates were lowered significantly for the vaccine group. 1.4% of residents who were vaccinated died compared to 25% of the unvaccinated residents. No staff members died. Vaccines work. Examples like this Kentucky nursing home show us the value and importance of protecting our valued elderly members of our community and our younger workers who interact with them. Unvaccinated members of the community can unknowingly put other people at risk, including those people who are more likely to experience severe COVID-19 illness. Vaccines work, and we have so many people who we have the potential to reach with the information and support they need to make the choice to get vaccinated. This number, I think, is a really important one. And so this is where we move from discussing hesitancy to how we can build some confidence. Offering people support and the information they need can help support them in their own vaccine choices. And each person we support with these choices makes a difference in a state like ours. Here's some information that we know helps people who identify as conservative, like many people here in Wyoming. Understanding our people here allows us to provide the actual messages and support they need. Recent information shows that in surveys, 95% of doctors who were offered a COVID-19 vaccine chose to be vaccinated. We know doctors are trusted messengers, and their experience and knowledge helps guide the decision of their patients. In a focus group of people who identify as both conservative and COVID-19 vaccine hesitant, this information was a key piece of building confidence in these people. Hesitancy can and does move to confidence, and providers play a vital role in helping establish that confidence. When a provider who you have an established relationship with tells you that they've chosen to be vaccinated and that they vaccinated the eligible members of their own family, and they vaccinated many of their clients, and the people that they vaccinated were fine after vaccination, it's really powerful and empowering. It's these messages and personal stories that I hope to encourage you today to start sharing with those people in your daily lives, your friends, your family members, your community members, and your patients. 20 to 50% of those eligible for vaccination express concerns. Many of these people do go on to ultimately be vaccinated. It can be time-consuming to address the concerns and work to address accurate information in the face of misinformation and disinformation, but each person we help to get to that place where they choose to be vaccinated helps protect all of the people in our communities. Building confidence, especially in Wyoming, is a process that involves building trust and works best when we respect the diversity of our residents. We know that in Wyoming, our residents value their autonomy and their independence, and it's really important to make sure that the way we communicate about vaccines, especially about COVID-19 vaccines, centers this patient autonomy and choice. The national ad campaign around the COVID-19 vaccines picked this exact message for their messaging campaign, with their central messaging constantly repeating the phrase, "It's up to you." This is the message that we need to make sure we reinforce with our people. It's up to them. This is not compulsory. It's not a mandate. This is about choosing on their own to get vaccinated to protect themselves and those who they love. There's no one-size-fits-all approach that's going to address the concerns of every person in Wyoming. There's no way we can do a broad campaign or a quick TV ad that's going to quickly address the needs of everyone in our state who has questions or who has access needs. Instead, it's important to meet the needs of the individual in front of you who might be having an appointment with you or a conversation with you in your personal life. Tailor your messaging to the person in front of you, not a generic list of national talking points. Vaccination doesn't just increase our public health, it increases opportunities. And I think that's a really important point here. It increases our opportunities to see family and friends. It increases our opportunities to travel to places without worrying about getting sick. Vaccination against COVID-19 increases our ability to move forward in a positive way in every sense of that expression. I miss so many parts of my pre-pandemic life, and I look forward to the best parts of that pre-pandemic life coming back too. Vaccines are an important part of this process. I share this with my family and my friends, and I share this all of the time at work with people who are considering what role vaccines could play in their own personal lives. And I share this because we know that trusted messengers, people who other people look to for information, in local communities who are regular and active parts of community life, play a very important role in increasing vaccine confidence. People don't want to hear from faraway politicians or movie stars about vaccines, especially here in Wyoming. That's not the messages people value. They want to know from the people they trust, those they see and interact with, the people they know, about why they decided the COVID-19 vaccines were right for them. Trusted messengers don't have to be healthcare professionals either, although it's really powerful when local care providers do share their vaccine stories. Trusted messengers can also be faith community leaders and other community members who are known parts of the community people look to for opinions and facts about many subjects, including vaccines. Empowering trusted messengers to share their vaccine stories and facts can help reach people in ways that an ad campaign never will. I'm one person, but the people I interact with daily can start ripples that reach across my whole community. And the same is true for each of you. We have vaccine success stories right here in Wyoming too. I know right now it can be really easy to get discouraged when we look at our coverage rates. COVID-19 has been a long, hard time for all of us, from the initial days of the pandemic to the incredibly long hours and massive undertaking of bringing statewide contact tracing and testing to our state, and now working on vaccinating as many people in Wyoming as possible. But I think sometimes it's really helpful to take a step back and look at positive growth that we've had with other vaccines, like our HPV vaccine. Here are coverage rates for 2017 to 2019 for both doses of the HPV vaccine. Each year, we've seen an increase in the number of people being vaccinated and protected against cancer. Each increase, year by year, represents another person in communities and families across our state who has chosen to be vaccinated. This is another person who's part of a family, part of a community who's chosen to protect themselves against cancer. And I think that's really fantastic and exciting. We can help people make the decision to get vaccinated with support, information, and clear communication from their providers. My presentation today isn't about vaccine hesitancy and outlining why people are concerned about COVID-19 vaccines with no way to help them work through those concerns. That doesn't help people who are hesitant, and it doesn't help people who have already been vaccinated. And I think we've all seen enough news coverage that dwells on negatives without offering us any positive way forward. Instead, I'm here to talk to you about vaccine confidence. Stay with me for a moment. I am a huge dessert fan, sometimes to a kind of weird level. So I'm going to put this in cake terms. Think of this in terms of building terms, if that resonates with you better. As someone who has always admired those big, fancy, tall cakes, I can tell you that when I watch shows of talented bakers constructing them, those cakes stand up only when they're constructed with a firm foundation. And this is the same with any building project. This is how confidence works too. Layer by layer, we can help provide clear, consistent, appropriate, and evidence-based information to the people who are vaccine hesitant in our lives to help them address the areas they have concerns in, helping them construct a firm and solid foundation. It's not a fast process, but just like those elaborate cakes, the end result is amazing. It's helping support people in the choices that are right for them and helping them choose to be vaccinated. These layers of confidence for the people in our lives have tools too. The first one I would encourage you to consider is sharing your personal vaccine stories. When you have appointments with people, talk to them about why you chose to get vaccinated. It's okay with these stories to also share if you were hesitant or nervous initially about the COVID-19 vaccines. Share with your patients about how you addressed these concerns and that you ultimately did decide to get vaccinated. Let them know after you were vaccinated that you were okay. Nothing bad happened to you. You are healthy, and the COVID-19 vaccine is now helping protect you and those around you against COVID-19. For some people, vaccination was a really, really emotional moment. In the first days when those vaccines became available, I can remember seeing my loved ones who were frontline medical providers sharing how relieved they were to be vaccinated. And this was a powerful experience for me. I had spent months and months watching them selflessly and tirelessly work to help people who were sick with COVID-19, often at great personal cost, and seeing their relief over the vaccine really helped my initial positive feelings about the vaccines. Personal stories are powerful. Our connections to people help bring information past statistics and figures to personal experiences of why vaccines are important, and also the reassurance that vaccines are safe. I would also encourage you to counter misinformation and disinformation when you discuss vaccines with patients. Let them share their concerns, listen without judging, even when those concerns might sound really controversial, and then offer them the correct information. I know getting into a back and forth discussion can be really time consuming and emotionally draining. It can be really frustrating at times too. But ultimately, engaging and sharing what the evidence really says about the COVID-19 vaccines can help support people in deciding to be vaccinated and making that choice for themselves. And when they make that decision and when they have the correct information about vaccines, they're then able to share that story with their own friends and families as well. I believe here in Wyoming, each person matters. We're a small state. In our communities, we all know each other, or we're at least 1 or 2 degrees of separation apart. Each person who becomes empowered and encouraged to choose to be vaccinated has the potential to reach so many others, and I think that's really exciting. I also think that's why it's best to address concerns head on. We value that transparency here. We know people in Wyoming appreciate having as much information and honesty as possible. Sometimes that means when I'm talking with people, it means saying, I don't know, and I'm happy to find out. I believe the best way to handle a situation like COVID-19, where day by day we're learning more, is to be upfront with a person about that fact. Sometimes the more we know, the more we can share, and that's a really good thing. I also would encourage you to help in your communities remove as many barriers as possible for the vaccines. We know sometimes people who are on the fence about this decision will make the choice to get vaccinated if the vaccine is really easy to access. Access is important. If someone is interested in getting vaccinated and they come across a barrier or they run into too many roadblocks, we might not be able to get them back. It just might feel too difficult. Here in Wyoming, we have some really fantastic public health nurses, and I've been so pleased to get to know some of them, and I look forward to getting to know the rest of them. I have found them to be great resources in addressing our barriers and identifying barriers in our communities. In addition, please reach out to us here at the State Department of Health if you have questions or concerns about the vaccines or administering them, and we're happy to help. In line with that, one of the things I'm really excited to see starting to happen here is that vaccines are available now for primary care and other providers. I think the potential of offering COVID-19 vaccines at routine care appointments, which again is a little bit difficult over telehealth until technology changes, will be really great for removing these access barriers and also helping to build confidence. We know there are some people who just don't want to be vaccinated at a mass vaccine clinic. They want to be vaccinated in a familiar office with a provider that they trust, with a relationship that's established. They trust that relationship, and that's important to them, and I value that too. We know that some people prefer to make their healthcare decisions as personalized healthcare decisions, and having the option to make that choice in a personalized setting will be important for these people. This is where, as telehealth providers, you have an amazing opportunity to present information to help people to be better informed about their own choices, so then they can make a follow-up appointment and get vaccinated. The more options and choices we offer people, the better for building confidence and helping people choose COVID-19 vaccination. If you're a provider or work in a provider's office and you are not currently able to be a COVID-19 vaccine site, please consider offering the locations of your local clinics and how to register. Not everyone is coming across this information online or on TV or on the radio. Maybe accessing it from your clinic will start that conversation with them. Telehealth is such a great service to our community, especially in a state like Wyoming, where so many of our residents are rural and they have to travel, especially in winter, and this can be really difficult for them. I'm so excited that you're interested in helping support your clients and community and their vaccine choices, and I hope telehealth appointments can continue to be an opportunity to provide vaccine information for people who are working on making their own vaccine choices. Telehealth also provides such a needed service for our high-risk and immune-compromised patients here. I know many people who don't currently always feel safe with in-person office visits, especially as case rates continue to rise again and with the Delta variant, but they are thrilled that telehealth allows them to connect with their providers and still receive that important medical care. Telehealth gives them the chance to receive really tailored follow-up care in a way they feel comfortable, safe, and supported. All things we know are really important for facilitating important discussions like vaccine discussions. Telehealth also gives us opportunities to discuss vaccines, both COVID-19 and beyond, at specialist visits. Pregnancy telehealth visits are a great chance to discuss influenza vaccines as we come up to fall influenza season, as well as vaccines that may be important for your patient populations like Tdap's. We have some really great resources on our website for COVID-19 conversations, including some FAQs and printables. There's a couple of things I would like to highlight. We have a great resource. It goes through all of the most common questions we've heard from people specifically here in Wyoming in a really easy to follow FAQ format. We have one available for parents and adolescents. There is a very easy, I think, fun printable format available both in English and Spanish. And then we have a second parallel one available for adults. And this is a really great resource if you're having these conversations and people have questions that they just need some more time to work through to point them toward. It's also a great resource to make available in your clinic, or if you have staff who may have questions, just to go through and say, listen, I know you have questions. It's okay to have questions. Let's work through these. Here's some resources to help start those conversations. We also have social media shareable information. We have printable graphics. We have some really nice videos Dr. Harris recorded that go through the most common concerns we've heard here from people in Wyoming as well. And those are captioned with transcripts as well. One of the things I really love about our website is in the top sidebar, there's a translate option. So if you have someone where they need resources available in a language other than English or the Spanish resources we have available, you can translate all of our resources with that as well. If you have a specific patient population where you see a resource we do have available and it's not accessible to them, please reach out and we're happy to sit there and work with you. I think the more accessible we can make things, the better. More information and more support for people is just really important right now. So if there's something that you need and we don't currently have it, please just reach out to us and we're happy to work with you as you support your communities. I really appreciate your time today. I wanted to make sure we left enough time in case you did have some questions or other things you wanted to address. And I wanted to say thank you for all of the work you've been doing and all of the roles you've had during this pandemic. I know this has been such a long time, again, with the initial testing, the contact tracing, and now as we've moved into vaccination and we're moving now into back to school, getting ready for fall influenza and working on all of those recall efforts. Thank you for caring for Wyoming and the people here so much. And thank you for all of the work that is still to come. Together, we can help the people here with the information and support they need to choose to be vaccinated. There's so much room for positive growth before us, and I'm so glad that you're working with us together on this. Together, we will get past this hard time and back to the things and people we love.
Thanks, Holly. Wonderful. Now is a great time if folks have questions, comments, conversations they want to have. I know things are heating up with the Delta variant, so a lot of different sort of surges are happening. So you may have questions about that. Feel free to either put that question in the chat, but we really love to see your face and hear your voice. So definitely give us those questions through either one of those ways.
Rachmi Singh, Social Pharmacy Faculty at University of Wyoming. Holly, thank you for your presentation. You mentioned about social media resources. Can you speak a little bit more on that and who created that? And did you do focus groups with the younger population or talk to, what age groups did you talk to?
Yeah, that's an amazing question. The current social media resources we have available are a blend between the current media campaign that we've been running, and there were focus groups involved in that. And then a lot of work that's been done at the department level in terms of interacting with different communities across the state and asking them what their experiences have been, what their needs are, what they're seeing, interacting with our public health nurses about what they're seeing in their individual communities, and then putting together images that represent those concerns and hopefully take some of the work away from people and having to create their own resources. So if there's something that you have experienced in the community you serve that isn't represented in them, please send us an email or call me. My contact information is on this slide, and we're happy to work on putting that together. One of the things I've seen with COVID-19 is that so much of this is just dependent on the community you serve, and all of this changes so quickly. It's been really interesting to see how quickly information and misinformation spreads, and keeping up with sharing correct information with people has been a very interesting experience.
Thank you. Yes, I'm interested in health literacy too. So yeah, I don't work with the patient population here. I'm a social scientist, but looking at some of the other states' work. So Hawaii has a whole teenage population, and they are kind of running, the social media campaign for vaccines. So that was my thought, if you're able to utilize that population too. So thank you for sharing.
Yeah, absolutely. Thank you for that question.
Holly, I'm interested to know if you have a story from the field, either from you or one of the nurses or providers you've talked to, where someone had an aha moment and ended up getting the vaccine after being hesitant before getting it, and maybe what made them change their mind.
Yeah, we have so many of those actually, and it's been one of my favorite things to see how those continued conversations with people takes people who are initially very nervous about getting vaccinated. I have some personal friends who initially thought that the vaccine was produced too quickly, and then they started hearing some concerning things about side effects. Their side effect concerns were things that they had seen on social media specifically, and they were concerned about those fertility side effects. So we had a lot of conversation where it was a big back and forth of sharing resources about, here's how these vaccines were produced, here's how they actually work, here are the ways that we know that the vaccines are safe. It was sharing with them information about why the testing happens the way it does. Here's the phases that vaccines go through. Here is the difference between approval versus authorized. And one of the things that was very helpful for them specifically was hearing that when you have side effects after vaccines, an allergic reaction, typically we think of it happens immediately, but they were concerned about side effects that could happen more long-term. And learning for them that side effects after vaccines, long-term for that typically is within that first 8 weeks after being vaccinated. And so we have followed people now for months after being vaccinated, and we do have very long-term mRNA research. Some of the people I had talked to had had COVID-19 themselves, and they were very nervous about being vaccinated. They were concerned that their past experiences with COVID-19 put them at greater risk of severe side effects, and they were just worried about it. They had been so sick, they didn't want to do anything that put them at risk of being sick again. And helping them work through that you can get COVID-19 a second time, and getting COVID-19 a second time is really, really difficult. And getting vaccinated is a great way to help protect yourself against that. And then seeing them ultimately weigh through all of the resources and evidence and getting vaccinated, and then calling me and just saying, I got vaccinated and I'm okay, and how relieved they were. And now how relieved they are in their personal lives and at work, feeling safe and protected. It's been really helpful. Yesterday, we had a peer-to-peer webinar. We had a couple clinicians here in Wyoming present their experiences, and one of them shared a series of conversations that they had had with a patient who is a transplant patient. And so they were concerned about just the safety of getting vaccinated, and the safety of getting vaccinated was something that felt to them very new. And ultimately that patient did go on to get vaccinated and is also okay, and how just rewarding that was for that clinician, for that long-term relationship, to have borne such a great outcome for them, and now knowing that their patient is safe. So it's been really good seeing that. I wish that there was a quick way to just share a website with people and people would read it once and decide, okay, I'm going to get vaccinated. But I don't think that's the way it happens for a lot of people. For a lot of people, it's hearing their concerns and listening to them and supporting them and sharing those concerns and addressing those concerns and giving them time to think it through. And then a lot of those people do go on to get vaccinated.
Thank you.
Yeah, thanks for asking.
Other questions? Andrea, that might be a great intro into our poll, actually, if you want me to launch that.
That sounds great.
Awesome. So if people can see that, the question is, when you ask a patient if they're vaccinated, what is the most common reply? And maybe even instead of patient, you could say coworker, friend, acquaintance, you know, whatever fits your situation. So right now we have half of our attendees answered. Almost 70% have said yes, people are, and then a couple, no, I'm afraid of the side effects, and no, I'm waiting to see how others react. So I'll have that open for about 10 more seconds, and then I think there's one other question.
It's really interesting seeing these results. And there was a recent psychosocial behavioral profile that was put out, and it groups hesitant people into 4 categories, which I think is really helpful. When we think of hesitant people, sometimes we address them as if they're all one and as if they make those decisions all as one monolith, and it's really not the case. And it divides people into cost anxious, system distrusters, COVID skeptics, and what's the last one? And then there's one more, but each of those have very different concerns about it. Oh, it's the wait and watch. So it matches up with this, and it divides people out by every state in the nation. It was really interesting seeing here in Wyoming how many people are just waiting to see, and how many people, maybe they're interested in being vaccinated, but for them, transportation or childcare or paid time off work is a barrier. And how many people are maybe in that COVID skeptic camp. And the COVID skeptic camp is the loudest group of hesitant people. They're the ones maybe you see in every comment section on every COVID article online or in a newspaper or calling in. They're the ones we hear so much about, and we don't necessarily hear a lot about these other ones. They're the ones who I think we have the greatest chance in reaching by offering them more support and more information, and just more of these conversations where we listen to their concerns and help address those concerns. The COVID skeptics are the ones where I think ultimately we will be able to reach them, but it's going to be a much longer road. And I have complete optimism that ultimately we will be able to offer everyone the support they need to support them in their choices. But I think it's going to be a really long road with it. So I would encourage you, if you are interested in it, Sergo Ventures is the name of the company who did this. And it's really fascinating looking at just why people make the decisions they make and the different factors affecting the hesitancy here in Wyoming. It kind of goes along with this poll question.
And then we just had one more question, and this is more of asking patients about their vaccination status during a telehealth appointment. So it's just saying, when you do a telehealth appointment, are you capturing vaccine statuses?
So I would encourage you, if you are not currently asking about COVID-19 status in a telehealth appointment, I think it's a fantastic opportunity just to check in with people and ask. It also helps provide just a more complete patient record. Entering that into the wire is a great way to just keep up with the most updated record as possible. And it's also a great way to open that door. If you ask people, you know, have you been able to get vaccinated for COVID-19? And they say yes, that's amazing. And if they say no, that's also amazing. It's just an opportunity to check in with them and see where they're at with that decision. And if there's resources they need, maybe they just haven't had a chance to make an appointment. Maybe they didn't know that they were already eligible. Maybe there's a barrier you can help them address. Maybe there's a piece of information you have that would help them make that choice. And maybe it just, they needed someone to ask them specifically. I know it can be difficult to ask people. People can be a little bit reactive about that conversation right now. but I'm very hopeful that as we continue to see more people here in Wyoming choosing to get vaccinated, that people will continue to make that vaccine choice.
Okay, are there any more questions or comments that folks want to share? This has been really helpful, and Holly, great resources. I'm really excited to dig in after the webinar.
Thank you.
Well, happy Cheyenne Day to everybody who's in Cheyenne, and get out there and enjoy that sunshine with lots of sunscreen on. We appreciate you, and Holly, thank you so much for presenting. So glad to have you here today and have you as a resource for our state during a very interesting time. So thank you all for being here. We will see you hopefully next month when we start part 1 of our 3-part patient engagement series. Until then, stay safe, stay healthy, and we'll talk to you soon.
Thank you so much for having me, and thank you for coming today.